Greetings everyone. On behalf of CRISP Conference, I have Dr. Shantanu Deshpande here. He is the professor and head of Department of Cardiology at DY Patil Medical Institute. So today we have, sir, I would like to ask you 3 questions. The first question is, you are chairing the left main session. What are the 3 crucial points when you are assessing a left main lesion that an interventionist to keep in mind?
It was a very interesting session today. And first and foremost important thing, as Dr. A.B. Mehta said, is selection of a patient. And that is very crucial. And you need a heart team approach for selecting a patient. And you have to remember surgeons are colleagues. First thing is that. Now, if you are starting a left main program, the selection of cases is going to be very crucial and very important. And see, 3 things what I'll say is one is a selection of a case, second is a assistance with the imaging. Imaging becomes very crucial, especially in initial stages, and third is a lesion preparations. So your adequate lesion preparation, deciding the strategy, imaging helps in that, and your strategy should be predefined before starting a case. So you should know what you are going to do. You are going to do a single stent strategy, you are going to do a double stent strategy. What are your fallbacks? Like you are going for a provisional strategy. If the sideband gets obstructed, what is your plan B? What is your plan C? Are you going to change the strategy from one stent strategy to 2 stent strategy? Everything plan should be ready in advance. It should not be like this ki you are doing the case and suddenly something happens and you don't know what is to be done. So your plan A, plan B, plan C should be ready prior to starting any procedure. Imaging becomes very crucial in left main, especially in initial stages, because you have to it's important. Imaging is important for before starting the procedure, to know the lesion characteristics, what debulking strategy you are going to use, what strategy of stenting you are going to use. You are going to use provisional or 2 stent strategy, and lastly and not least, there is a optimization criteria. What areas you are going to achieve. So the new criteria you have to remember 6, 8 and 12, 11.8. These are the figures you have to remember nowadays. Okay.
Thank you for that elaborate answer. The next question is more to do with career of young cardiologists, as you are a mentor yourself. What is the advice that you want to give to young cardiologists? 1, to improve their patient care, and 2, to hone their skills.
Yeah. See, first, know your deficiencies. That's always I tell everybody, don't touch the patients where you are not confident. Okay. So first thing is and foremost, the patient safety is most important thing in anywhere. So for honing your skills, one is you basically you take help of your mentors, or you have so much resources available, like a conference like a CRISP, where you get educated yourself with the newer technologies, newer things, newer optimization criterias, and basically you can improve your skills as you go on. So knowing things beforehand is very important, like yesterday's complication session. So you know so many tricks now. So when a complication occurs, which can happen to anybody during the practice, you know what is to be done. You don't get confused. Your algorithms are ready. What is to be done? If the rupture occurs, you lose stent or you lose a balloon, what is to be done? Now some meetings like this help in such situations.
Okay. And now the buzzword all around is AI. And now AI is coming in imaging. What do you think will be the impact of AI in imaging in the coming decade or so?
The AI is coming big way, and imaging now the most, like I have been using imaging since many years. The main problem what I faced is if I am a single operator, I don't have an imaging assisting colleague. I have to do measurements myself. It's very time consuming, especially with the iOS. The problem was you don't get automatic measurements actually, and then actually whole strategy is based on measurements, and if you are not having measurements immediately, that's a problem. Now AI is solving this problem. You get all measurements within seconds, and actually you can plan procedure in a good way very easily with the help of AI. And there will be I don't know, this is a new field, and what else will be coming with AI, we are not aware. It's going to be disruptive. Maybe there are strategies even how to handle this calcium, whether it's a superficial calcium, deep calcium, what is the arc of calcium, and how to go about it. I think that those things will be very exciting, and we'll see in future.
Okay, we can't let you go without asking your perspective about CRISP Conference 2024. What is new, what is different, and what improvements can we make in the next edition?
Yeah, it is the first I entered this hall yesterday, and the hall itself was majestic. Like it was like a theater-like arrangement. I have never seen such an arrangement in the past. The discussions, the moderation of the two chairpersons sitting and conducting the session was one of its kind. And the most important thing is a crisp consensus and discussions which were happening around 10 to 20 minutes. That there's a good time for discussion. That is very important because people have queries, and the interactive nature of the discussions, like it was all delegates can ask questions online, and those are answered by moderators and experts. This is one of its own kind. Quizzes, crosswords, they add flavor to the conference. I think it is a wonderful job done by this committee, and a wonderful conference in all.
Thank you, Dr. Shantanu. We hope to have you again this time next year.
Yeah, thank you.